And we're very pleased to welcome everyone to be part of what is initially in the first hour a discussion about training, about the pathway to to practice as a single session therapist. We've offered the session without charge, as we're also want to talk quite specifically about the training course that you deliver over at Temenos, Wendy. So we're starting that course next week. So we'll also be saying quite a bit about that process as well. So hopefully everybody walks away with lots of learning about training, and we also get to tell you about the course. We have got 4 places left on the course for starting Tuesday night of next week. Well, Tuesday night UK time, 6 till 9 o'clock. We have got 82 colleagues with us here tonight. So we're hoping those remaining 4 spaces will, hopefully those colleagues are here with us, that you are with us. And yes, maybe you'll have some questions about that process, the training process, and we can get to them too. I think we're both passionate about this way of working, Wendy, and so pleased that you come and do so much with us at online events and also do the training at Temenos, because it also is a way into working in a single session way. And it also can really strengthen our work in brief interventions. And both single session work or time limited work doesn't get much airtime on counselling training courses. So we're very pleased to be able to, that Wendy, I'm using the word we, that you are kind of strengthening our capacity as practitioners in both of those ways. So yeah, very, very interested to be talking about how we can do that tonight. But before, well, I'm talking, but we kind of wanted to hear what has brought us together as a group. Like, where might you be in the training journey around single session therapy, or maybe even being interested in brief therapy? Have you done any training? Are you thinking about training? We also mentioned some themes around supervision in this kind of work. So we'd love to hear in the chat room, yeah, kind of what has brought you and what are your interests. I've been busy seeing what we're interested in. Well, maybe while we're just giving everyone a moment to type something into the chat, have I missed anything, Wendy, in kind of setting the scene for our conversation over this hour? Anything you're thinking about?
No, I think that's a very full discussion about what we intended to do this evening.
Thank you, Wendy. Yeah, great. Oh, we've definitely got an interest in the certificate training in the chat, so that's lovely. We've got the link to the course in the chat too, so it's easy to click through to. I'm always cautious to use names in the chat for the recording, so just in case anybody wonders, why are you not using my name? So lovely to see some students who are currently doing core training in, so you're very welcome to be with us as well and have a placement at a short-term service. I think that's often the way we see for our counselling and psychotherapy students at Temenos, that a lot of the placements are offering time-limited work as well. So that's experience of a lot of students.
I'd be curious about people who are working in that time limited or short term or whatever you call it. What is the offering that these services make to clients? How many sessions are we talking about?
Oh, we got a first response to that, 5 sessions. So thank you. That's great. And just noticing the comment around working SFBT, is that short?
No, solution focused brief therapy.
Oh, thank you for that. Yes, for EAP. So employee assistance programs are often contracting us to work in those ways. I definitely have done some of that work too, and maybe 1 or 2 sessions being offered, maybe up to 6 or 8. Yeah, so we've got more responses to you there, Wendy. 4 and 8, 8 to 10, 6 sessions. Yeah, 8 to 12. Okay. 6 sessions. So there's a real kind of average around that kind of 6, 8 kind of mark, a little bit more, maybe some doing a little less. Yeah, some comments about being in private practice, wanted to keep learning. Fantastic. 4 to 6 sessions maximum, so definitely a brief therapy. Great. Looking to optimize time for patients with limited medical aid benefits for therapy. Yes, so like the cost of therapy can be a real question for clients as well. Previously worked in the NHS when sessions were time limited to 6. Funding limited in private practice. So thank you for all these comments. Really appreciate getting a sense of where we are. School counsellor, useful to learn some techniques I could use when a student comes in via the drop-in session, which is normally a one-off session. And you do a lot of training for universities, Wendy, I guess, and some of those services will be doing drop-in.
No,
No, they don't.
very few do drop in.
Okay. Right.
Well, or what we're calling open access enter now service, what I call open access enter now services, because drop in, sort of like from up there. Walk in, some people can't walk, so I think the term that we kind of inclusive term is open access enter now services.
Okay. Yes. Yes.
But very few. I'm not sure of any. Certainly none of the universities that I know of structure they're offering around an open access, which is different from the appointment system. Most of them have an appointment that they make.
Okay. Yeah, I know I've got some colleagues in university counselling, know some colleagues rather, working in some university counselling services that have that open access, so students can come and get some contact.
What, without an appointment?
Yes, yeah.
Okay.
So come to the wellbeing service, and there's maybe a colleague on call, and if there's space, the student can have access.
Yeah, but it's a question of what they get, isn't it? What is offered to them at that point, So the thing about single session work is that you offer therapy from moment one. So you're not dropping in for an assessment. You're not dropping in necessarily for a signposting session, or it might turn out to be that. You never know. But you're dropping it. You're coming in. Let's put it that way. And you know that you're coming in to kind of to actually to something where you're going to get an hour of therapy, not an hour of anything else. So I think we want to be clear about that.
Yeah, yeah. Well, seeing the comment there too, I've had a couple of EAP clients recently for whom one session was all they needed. I think that's something you're often talking about in these workshops, Wendy, that is actually the most number of sessions in counselling is one.
Yes, the modal number of sessions, which is the most frequent occurring number in a series. The way I explain it, difference between the mode and the mean is if you've got 10 clients, 9 having one session and 1 having 100, then the mean is 109 divided by 10, 10.9, but the mode is 1 because the most frequent number of sessions in that series is 1. And so if most organizations that keep the data on that collect the data in that way, you'll find that the mode is 1. So and again, the research that seems to indicate that most of the people who have that one session, particularly when it's single session therapy by design, which is which is the most ethical way of doing it, that you and the client know that you're meeting for one session, on the understanding that you're both going to work together to try to help the person to walk away what they've come for, but knowing, and this is the important bit, knowing that further help is available if the client needs it. It's not just one session and one session only. That's why I call my own particular way of working 1+, capital O, capital N, capital E, plus added to the word therapy, because again, we're aiming to help the person in one, but the plus indicates that more help is available should they need it. So I think that is, that's the important thing, and that work, as we talk about a lot on the course, is driven by the mindset, which is really, I can see the heart of this way of working. That it's I think I've got a list somewhere of 28 aspects of the single session therapy mindset that at least you need to be aware of at least some of the time. To compare that with the conventional therapy mindset is an interesting, experience. And so one of the things about the training is that we're not saying, don't do ongoing work, because that would be silly. But what we're saying is, when you are doing single session work, as you will be, either by default or design, allow it to be driven by this mindset, and other ways of working will be driven by their mindset.
Yes, holding that mindset in the work. And I was wondering if anyone resonates with that experience of, I know in my core training, there was an assumption of a longer relationship. And then when I went into my private practice, began to work with employee assistance programs, and those contracts were coming through with maybe 6 sessions, maybe 3 or 4 sessions. It was a real adjustment to make. There's so much to take care of in core training, so it's not a critique of counselling courses, but just noticing that was a big adjustment to get used to, and it's great to have some spaces to think about that. You can see a resonance in the chat already. Definitely my experience. Yeah. Definitely a shift in mindset. And was that the case for you, Wendy? Or was it something that was more gradual, or you kind of felt natural to you? Yeah.
Well, my experience is really kind of for years, and started my career as a counsellor, John, in 1975. So not next year. Yeah, next year. Hey, next year, of course. We'll be sitting there in September 1975. You'll be hosting my 50th anniversary in counselling, and
I'm looking forward to that, Wendy.
Yeah, yeah.
Yes.
Anyway, so my experience is that once I would do training, particularly in terms of day's training or a half a day training, I always made it my practice is to actually demonstrate what I do. And so over the years, I've done probably over 700 single session demonstrations. Now, it didn't really occur to me that I was doing single session therapy until I kind of reread Moishe Talman's book on single session therapy, the one that really started it all off in 1990. And when I came back to that book, because I read it the first time and interesting, but it made no impact on me. But second time, it really resonated. So the book hadn't changed. I had. It occurred to me that I had been doing single session therapy in that demonstration format for years, and I think doing that really help me to adjust to a pace and to have a focus in terms of doing that work. So that is what enabled me to, to kind of have the segue, if you like, between ongoing work and single session, therapy work. And I think that was something which not everybody does, doing a sort of training course, workshop. And so the important thing is, once I actually got involved in the single session community, I was primed, to do it, if you like. And that was really the helpful experience. I then did some training at the Bouverie Centre online, and and now doing that here with you, John.
Yeah. Yes. So you had already been doing it, and
without knowing I was doing
without
it.
knowing
This is
it,
a
yes.
strange thing.
Yes. Okay. Okay. Was there anything else about Talman's book when you went back to it? So you kind of thought, oh, well, I'm already doing this.
Well, I was looking for. I was coming up to the end of my university career as a professor in 2014, and I was looking for a challenge, and I was, it's either going to be getting involved in single session therapy, because you will hear stories about how long people had to wait for for therapeutic services, which which were quite I was kind of offended by that, months, in some case years. There was a story that I won't name the university, but at the time, before they took to a single session therapy model, they had a traffic light system: green, orange, and red. And if you went as a client in September and you were flagged as being green, you'd be offered an appointment a year later. So that and the other thing I was kind of thinking about was starting up a procrastination clinic, until a friend of mine who was more kind of business minded than I am said, well, you could do that, but you'll probably be spending most of your time trying to chase up payments, with people who procrastinate, you see. Now, if I was, kind of savvy, I would have, do what coaches do and get paid in advance anyway. But the moment passed, and although I do specialize in procrastination in some way, not specialize in helping people to procrastinate, I should say. I don't specialize in procrastination. I decided to kind of throw in my, to commit myself in the twilight of my career. Let's say, to that. And most of the uptake has been with universities, but there have been quite a few sort of charitable organisations that have counselling services who also work. And I supervise for Mind, one of the Minds in Hackney. I also supervise counsellors who work in an organisation called Quell. They're interesting because they actually do text-based therapy. So I get to see the transcript of the work and give feedback on that. And so yeah, I'm kept busy, John.
You
Especially
are
by
indeed.
you.
Yes, I like to keep you busy too, Wendy.
Yes.
Yes, like retirement is not working for you, is it? It's
No, retirement is working for me.
yes, absolutely. Absolutely. Well,
Working for the university in the latter stages wasn't working for me.
yes, yeah, they can be really tough environments. And you're mentioning supervision, so kind of jumping about a little bit, but in the description for tonight, we also said, well, let's say something about supervision too, as thinking about training as part of a whole developmental journey, and wonder.
Well, yeah, I mean, let me say a little bit about how I see my own personal view is that, I mean, I run uh, half day, 1 day, 2 day trainings. And I certainly think that depending upon, what people want, um, that really gets over the information, gives them a little bit of opportunity to do the practice, but in ways that they don't get any feedback or supervision apart from over themselves. That what we do on the certificate course is, is that people do have an opportunity to do single session therapy with one another and get supervised by me live, which sounds daunting. And I know that you found that the prospect of it as a daunting, but the reality of it was less daunting. At least that's the story you say, John. I don't know whether it was true or not.
Yes.
So I think that for me, I think that that my concern is there are a lot of people out there doing single session work without the underpinnings of an opportunity to meet in a small group, really study something, ask questions about it, see it practice, because I do 4 demonstrations, live demonstrations on the certificate course. Then we talk about that and the live you know aspect of that, and then there's a supervision of it, and that's that 24 hour. I think it's 24 hours, isn't it? Of course, it for me is the minimum training to do this work. But then you obviously need to get supervision as well as you go on. And I think a lot of people think that they can do this work without the training and without the supervision. And I think they kind of find out quite quickly that it's really quite different to to what they've been trained to do before. So that's the reason why we're here. I think to offer that corrective emotional experience from a training perspective.
Yes. Yeah. So in terms of structure, we've got 8 sessions of 3 hours each, once a week. In terms of practicalities, the next cohort starts next Tuesday, a week today, at 6 p.m. UK time. So it'd be 6 till 9 for 8 weeks. And the first 4 weeks, you've got group discussion, you've got input in terms of presentation and the demonstrations as well, which is always really, really rich. And then 4 weeks of practice for the group to be working with each other, getting some feedback from you, which is, yeah.
Yeah, feedback. So I think that's the important thing. I mean, I think that one of the things that I do is that, as I say, a feature of the work that I do, even my private practice in single session therapy, people have the opportunity of getting the again the audio free. They do have to pay for the transcript, because I have to get it transcript. So I don't, I just pass on the cost. And I think that what is really rich is reading over my my own work, and kind of almost like supervising myself in a way. And we have done, John, under your kind auspices at online events, a number of books which have featured my actual transcribed sessions with clients. We've done one, a general one. We've done one on regrets. We've done one on procrastination. We're about to go into production on one on common emotional problems, and also coming up, if anybody wants to volunteer for this, I'm doing one on dealing with the various adversities that that people have, like criticism, rejection, unrequited love. John, I don't know why I said that to you, but anyway.
Why are you looking at me,
Well,
Wendy?
I don't know, John. And so, and that, I'm a great believer, because the best way of, if I look back at my own training, the best learning for me was being in a group as an adjunct group therapist with Albert Ellis doing therapy, working as a co-therapist with Arnold Lazarus with some of his clients with their permission. And it's that kind of, being in the room and then having an opportunity to talk about, what people were doing, and studying transcripts of what actually, is done. I'm a great believer in that. It's not the only way to supervise, but it is an important way to supervise. And the kind of, the melding of supervision of people talking about their experiences of doing a session and then playing in extracts from it, and getting some supervision on their skills, and having the group talk about how alternative ways of responding, I think, is a pretty rich kind of learning. And I know one of the things that I find is that once people have gone through their training, and having to do recordings of the training, initially on, when I was a lad, John, it was on reel-to-reel tape. I'm telling you, none of this cassettes nonsense. Then it went to cassettes. Now we're doing digital voice recorders. Is the idea that once you've gone through your training, that stops. And I'm saying, no, don't stop. There's still a rich way of actually learning from yourself and from others, and so. That's that for me, because I'd like to, see, before I leave this mortal therapeutic coil, of actually setting up a whole kind of collective of people who can train and supervise this work.
Well, that's the goal, to set up that practice community, I guess. And
yeah.
And
it works side by side so that people can get skilled at offering. And so you might have on websites, like I have in mine, I offer 1+ therapy, ongoing therapy, coaching. The client gets to choose the service that they think that they want, not which I think that they need. All right. I think that's the difference about, sort of about that.
Well, and that's really is at the heart of all your work, including the training experience. Because I did the course, well, it's not last year now, so it's just over a year ago, and we're all working. We're all learning to adopt a single session therapy mindset, but in the way that was just really us. So in all our sessions, they were all very different, but we were practicing as ourselves. Just as you're saying, the client choosing what they need, we're adopting that mindset into our own practice and our own person.
Yeah, I think that's an important thing to stress, John, is that there is practical implications of adopting the mindset, which is going to cut across different orientations. But people can bring their learning from their particular orientations that they generally kind of work with, particularly if the client's interested in that, or needs a bit of extra input, because the more general ways of working isn't going to necessarily develop a what they're looking for. You can actually share that, and that's an important thing. It's not, so we're not looking to. This is why I'm not sort of pushing for example, X approach to single session therapy. I might say my own work is informed by, but that's me. I'm not, and I'm not suggesting that everybody should practice like me, for God's sake. I mean, just because we share the same hairstyle, John, it doesn't mean we practice in the same way.
Got a slightly different approach to clients.
Yes. And the interesting thing is, if it's a bit like, it used to be great to do a single session version of Gloria. You've got, because that actually, Gloria, if you think about it, was single session therapy. If we did an update on that, you'll see 3 different people working in 3 different ways with a person who actually wants to nominate the same thing. Now, Gloria actually changed the the rules of the game because she was supposed to bring up the same issue with all three people, but she didn't. Did you know that? She kind of changed the rules of the game.
I
Anyway,
didn't think about that. Yeah. So,
but she
yeah.
did.
Mm.
But so I think, yeah. So what I'm saying is that you're not. It's not. It's it's a way of working that is informed by your preferred orientations, but not excluding other ways of working. And
Yeah.
so, like it or not, I tend to think of single session therapy as pluralistic practice in action
Mm.
because it does involve, provisioning of the client, involves drawing upon different ways of working, looking at things of an either or rather than sort of both end rather than an either or way. So, yeah.
Yeah. Yeah. Well, because it might be tempting for colleagues to think it's a manualized approach where you're
Oh,
then, yeah.
that is what it is not.
Mm. Yeah.
And you know, my version of if you see the Buddha on the road, kill him is if you find a sort of a manual that's being offered for everybody to practice single session therapy in the same way, burn it. Although I'm
Okay.
not a lover of burning books, but so
No, no, we're not
let me
encouraging that at
let me
all.
let me
No.
take that back, but don't use it. All right, that's
Mm.
what I meant.
Yeah.
I got a bit carried away with myself there, John. So, a minute. Yeah.
Like in all the sessions that you've done, all the demonstration sessions that you've done with us at online events, which is more than 100 now, I think.
Yes.
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 And you're absolutely authentically yourself, Wendy. You're not taking someone through a prescribed process. You're really
No.
being you with them.
Yeah. I mean, there's commonality. Because I'm one
For sure.
person, you'll see that there's commonalities across the ways I'm working. But the actual, I'm not, for example, I'm not practicing X therapy with everybody. I may be informed by some ideas that I can share, but that's about it.
Yeah. Yeah, that makes sense. And I'm noticing a question or a curiosity in the chat room, rather, like as a relational therapist, a longer relationship made sense. And the single session therapy is a bit alien. And I'm very curious. So can you say anything about that in terms of, because there's a lot in training about developing the relationship, how important that is. How would you see the relationship when you're meeting with someone once?
Well, I'd sort of say that the difference between Mick Cooper and I on this issue is that Mick Cooper talks about relational depth, and I talk about relational promptness. That you're seeing somebody promptly, and you're striving to develop a relationship with them properly. And the best way of developing a relationship with somebody in a single session therapy is to gear therapy according to what they want rather than what you think they should have. Because if you do the latter, you'll get the kind of not the resistance, but the kind of the holding back. So I think that I mean the research that has been done, that we haven't done a lot, shows that people who tend to benefit from single session therapy have a better working alliance with their therapist than and I think what is the best way of actually forming a relationship with person is to kind of take what they want seriously from therapy, and try to help them as quickly as you can. Um, you know, However, some people, the rhythm of what they are looking for and what they want is different, and that's why we're saying, not everybody, is going to want single session therapy. Um, that, but why not offer people a briefer intervention when they want it, rather than say, "Oh, I can't do that because I'm not trained to do that." It's a bit like going to a GP and with a common ailment and say, "No, I haven't been trained to offer you that." You'd be a bit strange. So I would love to see core trainings embrace this because it seems to be a lot of what's going on. You don't have to stop doing long-term work because a lot of people want, shorter term work. And, I mean, there are 3 examples of Freud doing single session therapy in the literature. So half the stuff is good enough for Freud, it's good enough for me.
Yes. So this is definitely a both and approach, isn't it? It's not
Yeah.
not like, oh, what's better, longer term, shorter term, one session. It's
No,
all
no,
and.
no, no. This is, and I think that really, in any service that works, it's that really mutual respect and understanding. I think everybody should be able to do both, but some people would. Well, having said that, let me take that back. I think that the people say to me, who shouldn't be offered single session therapy? And I say, people who don't want it. All right, people who understand what it is, and they say, sorry, that's not for me. I want longer term therapy, and that's fine. Um, and also, therapists shouldn't be compelled to practice single session therapy when they don't want to. I feel strongly about that. So, anybody here who says this is not for me, I don't want to practice in this way, fine. There's no sort of compulsion, and I would hate to feel that there are counselors out there who are being compelled to to work in this way. That's not what we're trying to do here.
Well, we also hope that's part of the value of the event, that colleagues can go, no, the thing that I love to do is that very long kind of relationship. I'm really strong at that. I love it. Well, great. That's, yeah. And I think, well, I'm kind of going sideways to something you said earlier that became very important in my practice, is getting started right away. And I really see that when you're doing the demonstration sessions, Wendy. I think really, as I was coming out my training, it was like, whoa, it's going to take us a few sessions to get this relationship started. And really, as I started to work in the AAPs, it's like, let's get the relationship started when we start. And I really see you doing that, Wendy. It's yeah, there's not a delay in that, and I think strengthening that capacity, even for clients that are maybe going to be with us for a long time, can just be great value for clients, because we're straight into the work.
Yeah, and as you know, John, I've been also looking at exploring the possibility of bringing a single session therapy to brief therapy, and I've developed a protocol for that. We've talked about how to bring a single session mindset to more longer term therapy at times. So you have the opportunity to do that. Um, I mean, it doesn't happen so much these days. Many years ago, I used to get referrals from therapists saying, look, I'm seeing this client long term, but they've brought up an issue which I can't deal with. Can you deal with them, in 1 or 2 sessions and then send them back? You know, which was fine, Um, but I would hope that that person could be then stimulated to say, well, okay, well, maybe I can work in a more focused way, even though it's within a longer term relationship.
Yeah, yeah, absolutely. And thinking about supervision, are there any things that you might think could are helpful to be different in supervising single session therapy as to supervising longer term therapy? Wonder if there's maybe any capacities as supervisors that it might be helpful to be thinking about, or.
Well, yeah, I mean, I think that this is what is I find a little bit troubling, is that the work is at the moment, single session work is up and down the country being supervised by people who are not trained or experienced to do it. And I think that's not right. But I think so number one, there's got to be an understanding between the supervisor and supervisee about what you're doing. And I think that my experience is that the idea is that sort of, what was the client's understanding? How did you get informed consent? Because that's really important. How did you begin the session? What was the goal that the client wanted to take away at the end of the session? How did you keep focused? What happened when the client, sort of moved away from the focus? How did you respond? For the work and most of it is actually kind of, in a way, solution focused, not in the solution focused be therapy way, but a more general solution focus, if you like. How did you create and keep to the focus? What did you draw upon to kind of develop a solution with the person? How did you rehearse a solution with the person? What was the action plan that you developed so the client would be able to, develop, to implement that solution? How did you encourage the client to summarize the session at the end? How did you encourage them to specify the takeaways and maybe generalize their learning? And how did you end the session? How did you sort of push for them to make another appointment straight away? Did you, discourage them from making, it's the ending, how you work with the idea that more help is available. So there's a lot of different sort of strands there. And I think one of the things that I find is that when counselors are working in a single session way in a service, that they tend, it's really kind of struggle for them to kind of, stop talking about what, the client's past and their history and the relationship in the sense, not the encouraging the client to kind of work towards that, but the more sort of transferential relationship. Not saying that doesn't happen, but I think there is that tension that that you need to slowly encourage the person to to kind of move away from that when they're actually doing single session work. So yeah, there's plenty of plenty of stuff to get your teeth into as a supervisor.
Yeah, thank you for describing that, Wendy. And I think that's part of what we're hoping for at Temenos, is more cohorts come through, that practice community builds. We can also build the supervision capacity too, and yeah, lots of opportunities to engage in training around there, and to be supportive to our supervisees who are doing that work as well. So yeah. I'm seeing the time, and there was a couple of comments I wanted to get to in the chat room, because I think we're getting close to break time.
Yeah, and I think it'd be useful if people had any specific questions to ask about the training course that we're putting in to kind of spend a good time to answer them now, really.
Yeah, absolutely. So if there's anything that is on anybody's mind, please use the chat room to let us know. So there was a comment here that I wanted to read. It's that the pace that is different when I started doing EAP solution-focused brief therapies early on in my career. I think single session therapy might be similar. I love doing both paces depending on what the client needs and wants. So would that feel right to you, or in terms of a different pace when you're working in a single session mindsets?
Well, I think that the idea is that you don't need to rush. Hopefully, when you'll see me work, I'm focused but not rushing. And so I think that for me, it's the relaxed but focused pace. It's a like we're not looking for you to do a 100-meter sprint, nor are we looking for you to be a marathon, but maybe to sustain the pace of a good 400 or 800-meter runner.
Okay. Yeah, press ups
with a good ending.
Yes. Press ups are not an obligatory part of the training, I guess.
No.
In terms, but yeah, I really appreciate the metaphor. Another comment here. So thank you for these from colleagues. It can very much be meaningful, relational, cathartic psychotherapy, albeit managed within a more focused, brief number of sessions. being brief doesn't mean being benign. Far from it. I wonder that's
Yes.
like being passive, something like that.
Yes.
Yeah. And another comment there. Esther Perel's podcast series, Where Should We Begin, was for me a powerful demonstration of how impactful a
I don't know
single
that.
session can be.
I don't know
Wow,
that.
yeah.
Do you know that?
I don't. That's a new resource.
Let me make a note of that. What is it
Yeah.
called? Where?
So
What?
Esther Perel, it's
Yeah.
a podcast series, Where Should We Begin? So thank you.
Where's that available?
Probably on the podcast platforms, I guess.
Where should we begin?
Yeah, can give that a Google later. Sounds good. We do have a question specifically about the course, so thank you for that one too. If we can't make this training, are there dates or plans for future single session training? So it might be a little bit last minute for some colleagues to come and join us in 1 week's time, but we do have dates in September as well already planned. And they're going to be afternoon sessions. So no, like evening sessions are not ideal for everyone. We've had some requests from Australia and New Zealand, so trying to get the times kind of reasonable for everyone. So yeah.
Yeah, actually, I do know that Esther Perel is a rather famous couples therapist. There's um a Swedish group that offers single session one at a time couples therapy in Sweden. And there's a book on that that's available for those people who do couples work, want to see how single session therapy can done it in a couples therapy format.
Great.
Will there be any workshops for in-person single session therapy training? That's an interesting question, isn't it, John? Well, I think if we're struggling to get a certificate going online, it would be even more of a struggle, I think, to get it on in person. Where would we have it? Sheffield, London,
Yeah.
South Africa? That's my vote. But
Yes, we're all coming to Johannesburg. That would be great. Yes.
no, Cape Town.
Cape Town. Okay, okay. I'm just thinking about the colleague that's with us today from Johannesburg. So
I'm thinking
we're all
about the
coming for
climate.
coffee. Okay. Oh, right. Yes, yes, of course. But maybe there would also be the option.
Yeah, never
It's
say never, right?
never say never. And maybe there might be opportunities for the practice community to come together for a weekend in person.
Yeah,
That could be
having,
a
or
nice
at
way.
least we could think about, yes, right, and also maybe given your renowned conference capabilities, John, with online events, maybe you could sponsor an online single session therapy conference in the not too distant
Yes.
future.
We have been thinking about that. That could be
We have.
exciting as well. Yes. All right. I think we might have got all the questions there. Okay, I think so. Some appreciation of your work in the chat room as well, Wendy, which is lovely. Oh, and a thumbs up already for an SSD conference. That
Yeah,
sounds.
right. Okay.
Uh,
So should we have a little break and then come back in a short period?
yeah, let's do that. How long are you thinking, Wendy, in terms of time for a cuppa?
Yes. Come back at 10 past 7, 10 past the hour, or 10 past wherever you are. In
Yes,
8 minutes, shall we say?
in 8 minutes. Sounds perfect. We'll put the link to the training in the
And if
chat room
anybody
as
wants to
well.
volunteer this evening, just let
Well,
John know.
and I think we already have a volunteer, so
Oh,
thank
do
you
we?
for
Great
yes.
stuff.
So we've
Good
got
stuff.
one
Okay.
and we're
Okay.
ready to go. Great.
Okay.